We see it a lot in our population. One is the diet. So we have a lot of vegan or vegetarian diets. So that sort of decreases the natural sources of iron we might get through meat and that kind of stuff. The other reason is heavy periods. So a lot of South Asian women do suffer from heavy periods, but then there's another barrier that we don't want to talk about the heavy periods and we just want to suffer in silence. So, oh, the period's heavy. Anemia is when your red blood cell concentration or your hemoglobin goes down. And that is the blood that's circulating in our circulatory system, in our bodies, that gives us energy and sort of vigor, I guess.
And how do you say that in Punjabi? I'm trying to remember what we say.
Well, when my patients come in, they'll come in with a symptom like kamjori hogi or something, but we usually say khoon kat gaya, but in Punjabi, they do call it like hemoglobin.
So a lot of people, when they're told they have low iron, it actually means they're anemic, right?
No, not well. We'll get into that,
Okay.
but yeah, but it is not low iron. I want to just correct you. It is low hemoglobin. So anemia is not low iron.
Hi, welcome to the Avaaz podcast. I'm Roop, the moderator. Avaaz is a podcast designed for South Asian women's health and wellness information. And I'm here with our fellow hosts.
Hi, I'm a physician, Dr. Nav. I am an emergency room physician with many years of experience dealing with South Asians and non-South Asians, women and men across the lower mainland of BC.
Hi, I'm Dr. Madhu. I'm a family physician, and I largely deal with the South Asian population. I've been working for, I hate to say this, over 25 years. Anyways, so one of the topics that I see very commonly, and we're going to talk about today, is anemia. So what is anemia? Anemia is when your red blood cell concentration or your hemoglobin goes down, and that is the blood that's circulating in our circulatory system, in our bodies, that gives us energy and sort of vigor, I guess.
And how do you say that in Punjabi? I'm trying to remember what we say.
Well, when my patients come in, they'll come in with a symptom like kamjori hogi or something, but we usually say khoon kat gaya, but in Punjabi, they do call it like hemoglobin. They'll say that. Like they'll say, and the parameters in India are a little bit different, but they'll say, oh, kinna hega mera globin, hemoglobin. So they do say that. Yeah.
And which the translation loosely is like low iron. So a lot of people, when they're told they have low iron, it actually means they're anemic, right?
No, not, well, we'll get into that.
Okay.
But it is not low iron. I want to just correct you. It is low hemoglobin.
Okay.
So anemia is not low iron. Low iron can be one of the causes, but it's low hemoglobin. So the red blood cell concentration is low, and that carries oxygen. So that's why it's important.
And you see it a fair bit in your practice. And Dr. Now, I'm assuming that you've seen it as well. How common is it in the general population?
Yeah, so it's actually fairly common. So first off, starting with kids, from age 6 months to about 5 years, we can see it in up to 40% of the population in that age group. It's also seen quite often in pregnant women. Again, almost 40% of pregnant women will have anemia. And then the general population is a little bit lower. It's about 30% of women of childbearing age, basically, women that are between the ages of when their menstrual periods start and when their menstrual periods end. But interestingly, it's found even more commonly in South Asian women. And we've found studies that show that the data supports that in South Asian women, we see it about 55 to 60% of South Asian women suffer from anemia. So today we're going to talk a little bit more in detail about why that happens.
So on this podcast, we do specifically talk about South Asian women's health and wellness. So of course, we're talking about anemia because it affects the general population. But as Dr. Nav said, it affects the South Asian women population even more. Dr. Madhu, why?
We see it a lot in our population. One is the diet. So we have a lot of vegan or vegetarian diets. So that sort of decreases the natural sources of iron we might get through meat and that kind of stuff. The other reason is heavy periods. A lot of South Asian women do suffer from heavy periods, but then there's another barrier that we don't want to talk about the heavy periods, and we just want to suffer in silence. So, oh, the period's heavy. One idea that is very prominent in our culture is bikulkean period. Like that you should really, almost like a bloodletting, like you should just bleed a lot, and that's good for you. That decreases the iron, and no one talks about it, and it is a misconception. And another barrier is not talking about it to a male physician. So you might not want to bring it up to your male doctor, right? The other reason is women again, putting themselves on the back burner. So if they are feeling tired or whatever, they're not getting the attention they need. See, Dr. Now mentioned in kids, we see it because in South Asian culture, milk is a huge thing. There's too much milk being given. And what we don't realize is the milk actually creates iron deficiency. So I have patients who come in and I'll have to ask them, so in 24 hours, how many milk bottles? And when it comes out, it's almost like talking to an alcoholic, and it'll go from 2 bottles to 6 bottles. And it's too much. So that is a huge issue.
We should explain though why that's an issue and how it causes iron deficiency anemia.
Sure.
It's because they're having so much milk that's not giving them enough appetite for any other solids that would contain iron.
Yeah, so they're not getting, it's a poor diet again. And then you can pipe in anytime. Well, the other thing is just not screening for things like cancer. So if you don't do the FIT test when you're 50 and older, or whenever you're supposed to do it according to your own risk factors, then you're just might miss stuff. Just not seeing the doctor regularly for checkups.
So a question for you is, you're talking about when young children, toddlers, babies are having too many milk bottles. So that means that they could have anemia?
Oh, 100%. Yeah, we see it all the time.
Okay, well, I thought it was actually something that you developed sort of as you were sort of in a menstrual phase and older.
Well, we said like 40% of children between the ages of 6 months and 5 years suffer from anemia.
And that's because of poor diet due to usually due to excess milk.
Yeah. And now you've mentioned already that one of the key symptoms that you've heard is, tekema, I'm so tired, I don't feel like getting up, I don't have the energy. What are some of the other common symptoms that somebody could watch for?
So they might feel short of breath when they're exerting themselves, even mild exertion. So even climbing the stairs, like, oh my God, I'm so out of breath. Like I must be out of shape. And it may not be that they're out of shape. It might just be that they're low in hemoglobin and iron carrying capacity. They might feel severe fatigue, as you mentioned. They might be quite pale. And it's sometimes the way that we as physicians will see is like we look at their conjunctiva, like underneath the bottom of their eyes, just to see how pale that is. That gives us a good idea, or their gums. To see how pale they are. That can give us a good indication of whether it's mild or moderate or severe anemia.
Also dizzy. Like I definitely have low iron, or have had. Actually, it's good now because I'm taking my iron pills. But when you're bending down and then you get up quickly and you're sort of like a little dizzy, that can be a sign of low iron as well. So there are subtle signs. And then in kids especially, they'll eat like ice or dirt or even paint from the walls. And that's called pica. I always say it's pica or pica.
I heard about little kids eating dirt, and I didn't understand why, because they're looking for iron.
Yeah.
Yes.
Their body tells them what they need.
Evolutionary craving for.
And another sort of non-specific one is cold hands and feet. Like I always have cold hands and feet, and I think 50% of women do, but that can be a sign. And as Dr. Nav said, just feeling short of breath, or with that, you can have increased heart rate sometimes. Just because you don't have enough oxygen going on.
Exactly. And just to sort of complete the list, mouth ulcers sometimes can be a sign of iron deficiency. A sore tongue can be. So there's a lot of different non-specific things that we find, but the major ones are the fatigue, shortness of breath, and lightheadedness.
And so would you have to have a combination of those symptoms for it to qualify? No. Okay.
The qualification will be the blood test, but that sort of gives you little whispers like, maybe I should go get this checked out.
Okay. So we talked about too much milk replacing a lot of other foods of nutritional value in young children. What are some of the other causes of anemia?
So the most common cause by far is iron deficiency. And so that, as Dr. Madhu was telling us, that's usually dietary related, or because you're losing a lot of blood from menstruation, heavy menses. So that's the two sort of most common reasons for iron deficiency anemia. But there are other deficiencies, not just iron. So if you have a vitamin B12 deficiency in your diet, or folic acid deficiency, that can also lead to anemia.
And things like pregnancy, because pregnancy, basically, you do have a parasite living inside of you that is taking.
That's a nice way to put it.
They continue to be parasites outside of pregnancy too. But they're, the baby needs what the baby needs, and it's going to get it from the mom, obviously. So that in pregnancy, it's very common to get low iron. And then there's some medical conditions where you're gut can't absorb things. And the most common one that I can think of is celiac. And so you're not able to absorb nutrients properly. And that can also lead to iron deficiency, like inflammatory bowel diseases, things like that. That can also do it.
And it's funny that you mentioned parasites, because actually gut parasites, true gut parasites, can actually leach blood away from your bowels and cause anemia. So if you've been traveling somewhere tropically and for months and months afterwards, you're like, where did I suddenly start becoming anemic? That could be a cause. It's not.
And I have seen it. It's rare, but I have seen it. It's pretty profound when it happens.
And in order to test for that, you do a stool test, right? Is that what the doctor recommends you for?
Malaria is another cause too. So it can actually destroy, like the malaria virus can actually, or parasite can destroy your red blood cells from within. So it just basically causes them to burst and they're no longer being able to do the job that they're supposed to do. And then there's other chronic illnesses like, for example, congestive heart failure or chronic kidney disease. So chronic, we call it anemia of chronic disease. So that disease itself causes you to not produce good quality red blood cells. So you're, by definition, you don't have enough actual normal healthy cells, and so you're anemic.
And then there's some inherited disorders. I'm not going to get through to all of them, but the common ones is alpha and beta thalassemia. And thalassemia is when the heme chain or the hemoglobin proteins aren't made properly, and they cannot then just genetically carry the oxygen properly, and so your hemoglobin is low, and there's really no cure for that, so to speak.
And there's a couple of serious causes of anemia as well. So, for example, there are some intestinal cancers, bowel cancers, that will cause you to leak blood again into the bowel, which you may not even know. Because you don't see it bleeding, you can't feel it, but you feel the effects of having the anemia as a result of having the cancer. So those are serious causes. And then, of course, putting on my emergency medicine hat, serious bleeding from trauma would be another cause of anemia.
Right. So it sounds like if you're not getting enough iron through your food choices, or you're bleeding a lot, those are some of the key causes of anemia.
Yeah, and once we identify the causes, then we can treat it.
And how do we treat it?
So if we,
is it like, you know what it reminds me of? Is one of those cartoon, the Popeye?
Yeah.
Popeye the Sailor Man, he has to all the spinach and that's how he does it.
There you go.
Is that a solution?
Well, we have to identify the cause, and then we can get to the solution. So if it is iron deficiency due to a poor diet, then you can try to fix your diet, make it more iron rich. Even if you're vegetarian, there's green leafy vegetable choices, so on and so forth. However, if you still can't, then you can take iron pills. Like for me, I am not exclusively vegetarian. I eat meat, maybe not a lot. So I do take iron pills, and that's definitely helped me. So I wasn't getting enough in my diet, probably balanced by heavy periods and so on. And then if you are having heavy periods, get that treated. What's the cause of the heavy period? So everything, you have to figure out what's causing it and then treat the cause. So if there is no real cause and that's just who you are, then you can get an IUD, you can get birth control pills. Like there's so many different things. But first we have to find the underlying cause.
And so we were talking a little bit about if one of the causes is nutritional, what can be done about that?
So I can give you some examples of foods that are rich in iron. And so that includes meats, especially red meats. It includes green leafy vegetables, including the spinach that Popeye eats. Fish and poultry, not as much as red meats, but still has it. And then lentils and beans, cereals that contain iron. So look for iron fortified foods, and anything that's rich in vitamin C, because the vitamin C will also help you absorb the iron.
And you can check the label of food to see if it actually says it's iron fortified. I know some cereals are iron fortified as well, just sort of thinking off the top of my head there.
Yeah, you see them. They'll say iron fortified. I never actually clued in on that until we actually started doing the podcast. Oh, that makes sense. No, it says iron fortified.
Yeah.
It makes total sense. Even baby cereals are iron fortified.
That's right.
Yeah. So any final thoughts on anemia and things that our listeners and viewers might want to know about?
I think for South Asian women, really listen to your body and don't put yourself on the back burner. So if you're feeling a little bit downtrodden, tired, just pop into the doctor's office, get your blood work checked, and then maybe something will show up.
And we should also talk about taking iron as a supplement. So iron or oral tablets are a great supplement if they're taken every single day. But a lot of women have gastrointestinal upset. Like they either get stomach pain or they get really bad constipation to the point where they just can't tolerate taking it anymore. So in situations where your body either doesn't absorb the iron orally by mouth or you can't tolerate it, you can be eligible for iron infusions. That's intravenous infusions. So you have to have a visit with your primary care provider to see if you're eligible. But if you are, they will help you get that through usually an inpatient setting like a hospital or an inpatient clinic. And usually, I believe, I think Dr. Madhu was telling me that you would get like a couple of doses a week apart. And that usually brings up your
brings it up.
baseline.
Yeah, that's what I usually do.
That you can then tolerate a lower regular dose of iron, oral iron.
Yeah, so if I take the regular iron, like I don't do well on it, so I have a lower dose one, but you have to consistently take it. So I'm very consistent, and then I'm good. So the other thing is take it every day.
Yeah. And I guess if you get regular checkups, right, maybe even an annual blood test, and then you keep checking your iron, then you know if you might need more or you might
the doctor will tell you how to take it and follow up depending on the individual case.
It does take a month, right? We have to say that it takes a month for you, to the point where you start taking the iron tablets, for you to build up enough red blood cells for them to really measure it in your bloodstream to see if it's effective.
Okay, well, thank you. We're so glad you could join us today for the talk on anemia. This is the Avaaz podcast. We talk about South Asian women's health and wellness issues. We hope you learned a little bit today. Please connect with us on the regular. We're found on Instagram, TikTok, Facebook, and you can also find us on YouTube. Please join us, connect with us, share, DM us with your ideas, and we hope to see you again next episode. Thanks for joining us.